Probably is on, right? Good.
Yeah. Yeah. Only just went off, I think.
I'm sorry.
That one went off, I think.
Off?
My name popped off.
Good.
Yeah. It's on.
It's Ellen, apologies there. Great. Is John back on, Will?
Here. Just trying to
Okay.
Hmm.
If not, we'll change the order. Hey, John, you'll tell us when we should get started.
I just wanted to let Madison has joined the meeting also.
Is she joining us? Did you get in touch with her?
She joined the meeting right now.
Wonderful. That's great. Thanks.
Well, let me know if we're just good to start, of course.
Okay. Whenever you're ready, you could start with your speech first.
Okay. Good evening, everyone. Welcome. This is your first time joining us virtually. You will notice that you're all currently muted and I will remain muted throughout the meeting, except for the co-chairs and any presenters who are moved for the agenda. Following the presentations, as we move through the agenda, the co-chairs will call on members of the public wishing to speak. You can participate by going to the react icon on your device and pressing the raise hand button, not the wave or thumbs up, as those disappear. Only press the raise hand button once. If you press the second time, we'll go back down. If you are calling on your phone, you can go to *9 to raise your hand and *6 to unmute yourself. Be on the lookout for a prompt asking you to confirm unmuting once the co-chairs call on you. The chat is available for technical support only to help with Zoom software problems, not to ask co-chairs for questions. They will not see the chat. If you are using an older version of Zoom, you need to go to the person section where you will find the raise hand feature there. Please do not raise your actual hand or wave the screen, as you'll be unable to see you raise your hand. Chat will need technical support.
Thank you. I'm Barbara Rutter, and I'm with my co-chair, Wilma Johnson, is sitting next to me. And we are first of all, I just want to thank Will and very much John, who's helped us so much along the way. This is turbulent times, but a lot of us are very anxious about what can happen and what is happening. And so we decided to have a meeting just to discuss what are some of the senior services that are around and what happens if there is some disruption to either Medicare and Medicaid, either in terms of money or anything else. So we thank these two speakers that are going to come to explain it all. Madison Ayala is from the New York City Department of Aging, and she is the government affairs officer in Manhattan. And she will be talking about what are the services that they provide, how important they are, and hopefully they don't go away. And then we're so pleased to have Sarah Daly, who is from Leading Age. She's the director of government affairs, and she will help us understand what will happen, the importance of Medicare, Medicaid, what do they do, and possibly what we need to make sure that there's no disruptions for it. So, Madison, do you want to get started uh, and talk to us? And by the way, if either one of you need to share the screen, John, you'll be able to do that. Am I right? Great. Madison?
I see she has two accounts on here. I'm not sure um, she's having technical issues.
Uh, is she unmuted?
Yep, I requested for both.
Hello?
Oh,
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 I'm so sorry.
it's all good. All good. I'm gonna kick the other account. Is that okay? Oh,
Madison, are you on? Is she unmuted?
uh, I'm gonna ask her to unmute herself, but I'm just gonna remove
Oh.
the other one. Is that okay?
Yeah.
You can remove the other one.
Okay.
Yeah.
Okay, Madison. Thank you.
Mm-hmm. Okay, so I am gonna share my screen. If you could allow me to do that. 1 second. Okay. Let me know if you guys can see the screen.
Yep.
Yeah. Okay. Okay. So I'll just be doing a short presentation on the services that we offer here at the Department for the Aging. Once again, my name is Madison Ayala. I'm the Government Affairs Officer. And yeah, so I will also be dropping all my information in the chat so that if there are any people here that need help or need to get connected to any of these services, I could do that. So we start with a quick introduction. So NYC Aging is a local government agency as well as the largest area agency on aging in the United States, administering and promoting the development and provision of accessible services for older persons and serving as an advocate on legislative and policy issues. This is just a quick overview of the demographic of older New Yorkers in New York City.
Madison, we still are up to like I'm not sure if you're flipping through slides, but it just shows like the options for opening the slide, not the actual slides right now on the screen.
Okay.
Yep.
I'm not sure.
Yeah, you may have to manually click on each one.
Yeah.
Okay. I'm not sure.
Oh.
Okay, let me try again.
Okay.
Can you see now?
Yes.
Okay, can you see when I just click on like the next one like
Yes.
that?
Yes.
Yes. So you may have to manually do it.
Okay. I guess when I like put it in presentation mode, it kind of comes off. I was here. Okay, so this is just a quick overview of the demographic of older New Yorkers. New York City's large older adult population includes 1.73 million people over the age of 60. Of New York City's 8.65 million citizens, 20% are older adults 60 years of age or over. So that just shows the amount of people we are able to service. And this is an overview of all of our services. So we have three different like bureaus, if I may say. The first being community services. So that's our older adult centers, naturally occurring retirement communities. Those are NORCs, aging wellness services, transportation services, mental health initiatives, caregiver services, and social adult daycares. Then second being case home-based services, so that's case management, home delivered meals, home care, friendly visiting, elder justice, and tenant and eviction support services. And lastly, we have Aging Connect, which is our hotline, if I may say. It's like the holy grail of our agency. You could just call that, and they'll connect you to any of the services I just named. And then High Cap, for assistance with health insurance, Senior Community Service Employment Program, and Silver Star Silver Corps, which are both workforce programs. So our agency is built on the community care plan. What the plan is to allow older New Yorkers to age in place, reflects and responds to the growing and more diverse older adult population, focus on flexibility, equity, and expansion to underserved areas, including to help combat social isolation, and continuum of community-based services promoting linkages, collaboration, partnerships, and synergies. Okay. Um, as I just said, we're built off the community care plan. So the Department for the Aging envisions a New York City where older adults benefit from the cultural, art, and entertainment this city offers, coupled with supports, care, and services to live in their homes and community with dignity for their lifetime. A city that provides comprehensive community care that reflects one's language, cultural, and religious preferences. Community care includes nutritional, social, educational, and in home care, where the goal is to avoid institutional care unless or when it's the individual's choice. And last but not least, we do have an initiative called the Cabinet for Older New Yorkers, where it's an interagency collaboration. So all the agencies here, we do meet to do interagency collaboration. So there have been a lot of things that have come out this cabinet. It launched in September 2022. And yeah, this is just our contact information. As I said, the Agent Connect hotline is R311, but you're able to talk to somebody in person from 8 p.m. to 6 p.m. And our you can stay connected on our social media as well. And that's all.
Thank you.
No problem.
I'm not sure if we should ask questions now or we should wait. What do you think, Sarah? Maybe we will ask questions now and then Sarah, some of the questions you will be able to answer. Unless, would you give us an overview first of what you do, and then there may be questions that both of you would answer.
I think it might be appropriate to take any questions now from Madison and then again later if other questions arise. Does anyone have questions now?
Sure. John, do you see who has their hands raised?
No hands raised currently. Oh, Bill does.
Right, Bill? And he's unmuted?
Hi, can you hear me?
Yep, thanks.
Yes.
All right, thanks. Thanks for presentation. I just got a question. I know in the de Blasio administration, he set aside, I think, if I recall correctly, $58 million in investment for adding additional centers and services in underserved communities. So is that still going on or that had expired?
I'm sorry, say that again.
I recall during the former Mayor de Blasio, in his administration, I believe he set aside $58 million investment to add additional centers and services in underserved communities. Is still ongoing or that has expired?
I'm not sure about that exact pool of funding. If Madison knows, I can.
Sorry, I just can't unmute sometimes. I'm not specifically sure either. I know we're like in the budget season right now, so we had a preliminary hearing in March. We're still going through that with OMB council and all of that. So I can just maybe check on, I guess, that funding, but as we speak right now, um the budget is not set in stone, if that makes sense, because we're still going through it. And yeah, but we did have a budget hearing last month in March, which is on the city council's website. If anyone's interested and wants to take a look, I could send that over. And yeah, if you're interested in
Okay, thank you.
I think I'm going to ask a follow-up. So the senior centers that are in CB8, our area from 59th to 96th Street on the east side, and Roosevelt Island,
Mm.
are there those that
Mm.
fall under your purview,
Mm.
Madison? I think we had talked, did I talk to you or Charlie about it?
You
About
said the
Family
older adult
Isaac,
center.
Lenox Hill. Am I right?
Yeah, they fall. Yeah, all the older adult centers fall under Department for the
And
Aged.
so it's the cities, so it's the city's money under you that will get to
Hello.
hire the social workers and staff and all of that.
Yeah, the city. Yeah. Our older adult centers
You keep
are
going in
funded
and
by
out.
city tax levy, federally funded. So they're. I'm sorry. Can you hear me now?
Yes,
So hello.
We can
yes.
hear you now. Oh,
Okay. So what I was saying was, if I heard you correctly, because it's a little
Things
the
wrong with the
connection's a little
microphone. Yeah,
bad, but I was, which is funded by city tax levy dollars. Hello. Did you guys hear
and the
that?
important things like
um,
like delivery of food to seniors and so on. What would happen? I know you said that, I think it was Charlie had said that you don't get Medicare, Medicaid money directly. But
Mm-hmm.
if the budget has to swerve someplace else, are you worried that some of your services will be cut?
Well, most of our agency is funded by city tax levy dollars, once again, but I would say maybe a small percentage of our agency comes from federally funded like federal tax dollars. Maybe 8%, maybe less than that, if that. So our agency isn't, I guess, like super concerned, because our agency isn't funded by the federal dollars.
Okay,
But I will say that you did say like home delivered meals in that, because I guess you were trying to say like Meals on Wheels is a
yeah.
federally funded program. um as of now, we're watching. So we're just trying to, we look at our congressional partners and just see how they're advocating for our seniors and things like that. But as of now, there's no cuts to any funding in our agency. If there was to be, we would have to, yeah, I guess we would have to look over the budget, but right now there isn't any alarming
Do you have
things
questions?
from Washington.
You have to talk louder.
But I have a question about, the responsibility of a senior center to, provide certain services to the seniors. For instance, um, not just the meals, like, arts and crafts or, dancing or exercise groups. Who funds that?
All of that mostly comes through the city tax dollars, not
And
yeah.
does DIFTA have anything to, in giving money to centers to have these programs?
I'm sorry, say that again.
DIFTA.
Mm-hmm.
Try
Do
to say,
they get do they fund centers to do different programs?
Yes.
And who manages that? The directors or the agency partners or who?
So we contract with organizations, NGOs, and they like are providers. So we contract providers to service the older adult centers.
Oh,
Yeah.
so there are a lot of centers that close down, especially those that are maybe in a district, in our district, and several other districts. And the reason why they closed down, it seems because the lunch programs are not high. Lunch programs seem to have the main income that the center gets from DIFTA. If you don't have enough lunch people, the center closes down.
Mm-hmm.
Is that true?
I'm not 100% sure. That would be a question for our Bureau of Community Services team. I could check on that. Maybe it has something to do with the average daily participation ADP, but I can't confirm that. I would have to check on that.
and when you talked about transportation, is that accessoride or is there more transportation than that?
No, it's different transportation. We have a transportation provider in each borough, in different sections of each
What is
borough.
that? What do they do?
I'm sorry, you said what do
What
they
is the
do?
purpose? What is the purpose? Like who takes advantage of it and so on?
Older adults and anyone can call our Aging Connect hotline and say they want to be connected to a transportation provider, and they can get a ride from, let's say, one of our transportation providers is organization CART, Project CART, and they can connect with them and get the ride that they need, maybe to a medical appointment or somewhere else they may need to go.
Do you have to sign up? Do you have to be on Medicaid? Is there anybody can do it?
No, yes, anyone can do it.
And it costs money? I would have to pay.
No, I mean no. Sometimes we ask for like small donation, I guess, but it's not mandatory.
So, I mean, sometimes I may have a medical appointment and I have to get home. I could call that up.
Yes, I would recommend calling in advance just because there are other people in line, so it might be a wait. But definitely, yeah, I could connect you with a transportation provider and get you,
So you would call the Department of Aging and they would connect you.
yeah, with the organization that services your area.
2 hands up.
Do you know about that?
Yes, I do.
Oh.
2 hands up.
There is a hand on Merrill.
Yeah, hi. Okay, I don't think we gave a complete answer to our previous question. Would there be cuts, individual cuts? The perspective is $880 billion of Medicare cuts. That means people who would previously get services or pay out of pocket are now paying higher deductibles and getting less service, particularly with physician care, which is very bad because people want specialized services and physicians won't provide it at the cost that Medicare is covering it.
Mhm.
Is the city responsible for that, for covering individual, how shall I say, sections in care? Can they help fund doctors? Can they help fund transportation to doctors? Is there any allowance that would make that fill in that gap? Because it seems to me that that's the problem. The state and the city aren't going to be able to afford these cuts insofar as they do thanks.
Yeah, so I can't really speak to the, I guess, the cuts. Our agency, if there were cuts, I guess I honestly can't say if we would be given more money to fill in the cuts or what would happen. We're just playing it by ear, honestly,
Your
right now.
services would be limited. Got it.
Yeah,
Okay, thank you.
yeah. But I could definitely uh check on that, I guess. But right
And
now,
I can help speak to that
Thank
in
you.
my
Right.
piece.
Please.
Not to interrupt, but
So Sarah, you want to talk about it? That's great. Thank you.
yeah, and I can talk about that now. I mean, Ellen and Bill, I see there's two questions left. Are your questions related to kind of the federal state landscape, or are they city aging services focused? Both. Okay.
Okay.
Glad to
Who is
say-
going first? Is it
So
Bill?
I
Can
may,
we, how about
Oh.
Sarah and then Bill, and then the remaining question? I think Sarah seems to be responsive to all of them.
Okay.
I can try. I think between Madison and I, she is much more familiar with the city landscape. Even I just learned a lot in terms of I didn't realize how much city taxes were levied to help support some of these aging services in New York City, which I think is going to be a major positive and hopefully saving grace for the services affected in New York City. But so I work for Leading Age New York, and we represent exclusively not-for-profit and publicly owned long-term care providers, everything from nursing homes to assisted living, home care agencies, affordable senior housing, pretty much the entire continuum of long-term care services we represent, including a lot of home and community-based services and NORCs, for example, naturally occurring retirement communities, things like that. So I typically deal much more at the New York State level. However, in light of everything that's happening, we certainly are working a lot more than usual on the federal side as well. And so to set the stage, it sounds like there's already an awareness, of course. It'd be hard not to be aware of what's happening federally right now. As Meryl mentioned, there was recently, the Congress is pursuing a budget reconciliation process to fund the federal government. And last week, the House and the Senate finally came to an agreement on a resolution that is giving instructions to now budget committees, which will further distinguish what policy measures will be included in a budget reconciliation process. As Meryl mentioned, the numbers that are out there are extremely concerning for Medicaid and Medicare, but I would say most concerning for Medicaid funded services. I think there's a strong awareness within Congress that no one wants to cut Medicare. It doesn't mean it's off the table, but I wouldn't put anything past, I feel like there's a lot of unprecedented things happening right now. So I would say Medicare is much safer than Medicaid right now in terms of potential cuts. Though, because Congress is, no one wants to cut Medicare essentially. Medicaid is the area where we are fearful of cuts. And some of the numbers that are out there, as Meryl mentioned, the House is hoping to cut federal spending by $1.5 trillion, and 880 billion of that approximately would be cuts to the healthcare systems across the country. And a lot of that funding would be Medicaid. And so now you all have probably been getting ads, as I've been getting ads about fighting to protect Medicaid funding. And that's because mathematically speaking, if you're looking at a budget reconciliation process that's trying to cut funding by $1.5 trillion, there is mathematically no way that that can happen without cuts to Medicaid. And, to put it quite simply, when there are cuts to Medicaid, that does create a hole in the New York State budget. kind of regardless of what mechanisms are used to find savings at the federal level. There's a lot of different methods out there that are pretty policy wonky, including like provider taxes and just changes to federal matching systems. Like right now, for every $1 New York State invests in Medicaid, we get a match of $1 from the federal government. So there's a whole lot of things on the table for how Medicaid spending could be reduced. But when we talk about savings or reducing spending, that to New York State will mean cuts. And so New York State's healthcare system is already operates pretty leanly, right? We have expanded Medicaid coverage to, a lot of the services that Madison mentioned in terms of trying to expand, you know, just be more inclusive, of course, with, healthcare equity and expanding services to people that really need them. Of course, healthcare and housing are both integral to allowing people to contribute to our economies and be part of our communities. And so New York State has robust home and community-based services that we fund. But our Medicaid system is really quite lean in terms of what it is able to do with the dollars that we do have. And of course, investments in Medicaid often, in certain service lines, like we represent the entire continuum of care, home care, like I said, assisted living, senior housing, and nursing homes. The more you invest in home and community-based services or assisted living, for example, the less need there is for settings like nursing homes or hospitals, which are more costly to the healthcare system at large, right? So the whole concept being, if you're able to provide modest investments in home care and community-based services, senior centers, things like that, there's less cost later down the line, right? If we can help keep people living independently and healthily for longer. But yeah, suffice to say, when you're looking at $880 billion reductions, New York State may indeed have a hole to fill. And we at Leading Age New York are very concerned about that because we already say that there's access to care crisis that's unfolding in New York. And I'm curious to hear feedback from all of you in terms of what you feel like you're experiencing in your corner of the world. I'm actually local as well. I live in the Upper East Side as well. I'm reporting from there. So I'm actually part of your community as well. Curious what you experience as you navigate aging services. But yeah, I mean, we already experienced statewide and access to care crisis for older adults. Nursing homes have been closing. Beds are offline. And that causes backups in hospitals because hospitals can't discharge their patients to the next level of care, be it home care or a nursing home setting. If you need a nursing home for rehab just for a few months, or if you need a home care service, there's challenges in both of those settings. So when hospitals can't discharge people, there's of course a backup. So we're already seeing that happening in New York. And so the idea that New York might have a few $1 billion, I mean, we really don't know what the actual number is going to be. We have no idea what policies will really be initiated or pursued at the federal level. But really, any policy changes that impact New York State's funding from the federal government will impact the funding that New York State then has to fund our home care, our HCBS, which is what the acronym for Home and Community-Based Services, HCBS. That will determine the funding that New York State has to set the nursing home Medicaid rate, the nursing home Medicaid funding, Medicaid funding for low-income assisted living. That's the assisted living program. Affordable senior housing programs. We have a lot of programs that we advocate for and support at the state level that help older adults live independently in their senior housing settings for longer, again, reducing the need on the higher level settings. Those are, they're really every service line, we believe, is at risk of seeing reductions in funding statewide. And I do think it sounds like at the city level, there might be some kind of like safety net to help like make up the gaps, but there's going to be, of course, a reduction in what tax dollars at the city level can do as well, right? I mean, if every service line is hurting, how do they handle that? And I think a lot of this is uncharted territory. So that's just kind of setting the stage. I have a few, I can share my screen just for a few things. And I'll have resources to follow up with you on as well. But I'll just share a few things to kind of paint the picture. And I always, can you see my like little PDF window here?
No, yes.
Yes, yes, I
Okay,
can see
all
it now.
right. Thank you. I want to show you a different one. And of course, my computer is running slowly too. When I'm doing screen shares, it always gives me trouble. But let's see if I can fix this here. I want to show you a different flyer. Okay. All right, so this is just, again, this is the crisis in access to care that Leading Age New York has already been trying to depict to our state elected officials, trying to get the state to invest more in the nursing home Medicaid rate, just to help paint the picture. Every dollar that New York invests, of course, is matched by the federal government 1-to-1. But New York State's nursing home Medicaid rates are already inadequate, and it's been resulting in financially distressed nursing homes. And when Medicaid funding, also just importantly, almost 75% of the people that live in nursing homes do depend on Medicaid. And so that's the main payment system for nursing home care. And so when Medicaid rates are inadequate, and this plays out in home care settings as well, when Medicaid rates or Medicare rates for that matter, because there's also a lot of discussion around the adequacy of Medicare rates for home care services. But when these Medicaid and Medicare funding mechanisms aren't providing enough funding, it's really challenging to recruit and find the staff that we need to serve more individuals and to ensure high quality care. And so a lot of nursing home beds or units are completely offline. There's 7,200 nursing home beds that are not available because of lack of staff. And the Medicaid rate at the New York State level has been so inadequate for so long. Our rates are based on 2007 costs. So it's been so long that Medicaid rates have been updated for current costs that there's actually a $1.6 billion gap already when you assess Medicaid reimbursement for nursing home care and the cost of providing that care. And that's all based on publicly available data. And so with that in mind, there's over 70,000 nursing home beds that are in financial distress, meaning they're at risk of closing already. And so this is all just to paint the picture of Medicaid is doing everything it can in New York. It cannot afford losing any other dollars because as we do, New York State is then going to have to make some really difficult decisions about which programs will lose funding. So that I think sets the stage. I know I can talk about this forever, but that's hopefully sets the stage a little bit for you all.
Can I ask
So,
a question? As of April 1st, New York State took over several hundred long-term care agencies. Now, it's been 3 weeks and they have not been able to pay any of these thousands of people that are staffing these clients because the state is so overwhelmed with so much to do, and they don't have the staff to service these people that they made sign up the PPL. Do you have any idea what's going on with that? And when the people that are working going to get some relief or pay for what work they're doing?
that's a really good question. Yeah, so you're referring to the change to like a single fiscal intermediary for consumer directed care, I think,
Yes.
right? With PPL.
Yes.
Yeah, so I wish I had a better answer for you. And so this also paints the picture too of what happens when programs and things are understaffed and underfunded. I think the Department of Health made this decision, or rather the governor, I think it was a governor proposal, and the state approved it, the legislature approved it, to move toward a single FI to streamline, again, trying to make more efficient. This is before any federal changes, trying to make consumer directed care more efficient. And I know that there's been a lot of issues with that. And I think that the state's doing the best that they can. I don't know for certain, but I do wonder if part of the holdup is probably the delay in agreeing on the state budget. Right now, we have a late state budget. The state budget was supposed to be agreed upon by April 1.
Right.
And so that may be part of the slowdown. I'm not sure how wages or payments are they may be tied up in the state budget process. We're hoping that we'll have a state budget process. I think I heard today that we might have a final state budget maybe late by the end of this month, maybe by the 29th or 30th. But
It's a long time away.
Rates for pay, yeah.
yeah, it's not
So
not
the
ideal.
aides that are getting low pay to begin with, how are they living without any pay at
At
all?
all.
I don't
What an
know.
unsafe situation.
Yeah.
And this is before our worry about what would happen on a federal level.
Right. And also, I'm getting feedback from the home attendants that doing work and not getting paid, and it's making me upset because they're upset not being paid. And how they gonna help me when they feeling really agitated about not being paid?
Right. And it impacts their ability to,
What can
I
we?
mean, really be a caregiver, right? I mean, when you're
Yeah.
a caregiver,
They can't pay
your
their
cup
rent,
needs
they can't buy food,
Right.
your cup needs to be full to be able to care for others, right? Absolutely.
anything, what are you asking? Is there anything?
Well, I just would like to know. I talked to the governor. I mean, not the governor yet, but I will. I talked to some of the senators, some of the
Simply.
assembly people, and nobody seems to even know what to do. They don't even tell me how to sign the timesheet. And when you try to get into PPL or try to get the help, they say, well, we're not there. I'm not authorized. The program is not authorized yet. They keep telling me, just fill your timesheets out and send it to PPL. They can guarantee pay from April 1st. Well, it's April 15th now, and they're working 3 weeks already, on the 4th week.
Right.
Third
And then
week,
yeah.
no pay.
I wish I also had a better answer for you. I think I know that we monitor this issue. It's not one that we take the lead on. But we agree that I think this is, I think, was our main concern with the change. We understand the desire to streamline the consumer directed program, but our concern is always having this gap in services. So I do wish I had a better answer for you. I hope that the state comes to an agreement on the budget soon and that hopefully we'll get some of these wheels moving. But it may be after the Easter holiday.
You're talking about 2 weeks.
I know.
And
And
they haven't really started on the budget, is that right? That what we heard yesterday at our meetings, they haven't started on the budget. They were talking about the proposals, the the discovery laws and things like that, and not the money part of it.
right. Yeah, I heard, yeah, you're absolutely right. You're completely on top of it. The policy discussions have been the main thing delaying the process, which the optimistic side of that is that I think that they're starting to come to an agreement on some of those more policy-oriented issues where the governor and the legislature were not agreeing. The good news is when they do come to an agreement on those, we expect that the rest of the dollars and cents of the actual budget should move more quickly. I think that people are working on those issues kind of in the background, but it's difficult to kind of finalize all of that until the policy stuff is settled. So yeah, it's just unfortunate. And certainly I've been working for Leading Age New York since, I think this is my 8th legislative session at the New York State. And certainly this is the latest budget we've seen. So I hope we're able to finalize it soon, especially in light of what's happening federally, because the longer that New York State process goes on, the more at risk we are at the federal level to have to respond to changes at the federal level.
Are there any other questions? Because I have a couple of things to say.
Yes. Ellen has her hand up.
Okay, Ellen, thanks.
So patient, Ellen. Thank you.
All right, so this had to do with New York City. And
Mhm.
no, it's like, I just like, nah. It's like, I don't even know why I'm bothering to ask this question yet, because it just seems like all this catastrophe was totally predictable many years ago. I mean, like, 10 years ago, this was predictable. So this is 80 years ago, this was predictable. When we saw the baby boomers coming up, we knew this was going to happen. And the failure to plan is astounding. Yeah, that's like astounding. And then, so I just have to say that. Now, my one question is, and I probably know the answer, is senior services in the mayor's budget? And he's a Democrat. Is the senior services in the mayor's budget?
I think that's a question more for Madison.
Right, Madison, are you still on?
Yes, it is.
It is, okay.
Mhm.
How does that work? I mean, do you know how much of the budget the seniors are going to get? So we don't have to wait for city council to vote? Is that the case?
No, we do. Well, the City Council Committee on Aging holds hearings, and they do the preliminary budget, and it goes to the mayor, then it goes back to City Council, and then, approval from the mayor. But yeah, senior services are in the budget.
In the mayor's budget? So
Hmm.
the mayor has set aside a certain amount of money for senior services. It's just that we don't know how they're going to be spent. Is that it?
Yeah, our agency is we get money from the budget.
Hmm. Okay, so generally what's in the mayor's budget, I thought that you would know approximately how much money was available to, the services, so the whole point of it is so that you don't have to lay off staff, that you don't have to wait for the city council to do its thing and decide how much money is going to be given to each particular agency. And they could plan in advance for knowing that they have much money available to them. They wouldn't have to temporarily lay staff off and then rehire them once the city council did their, came up with the budget. Is that the case?
I'm not 100% sure of what the budget's gonna be, or like specific numbers right now, but I can get that for you.
Isn't it true that the mayor's budget just started coming in, because we never really had money put in for seniors in the mayor's budget until the last mayor, or half of the mayor before this one? There was never any money in that budget for
Right.
seniors.
That's correct.
It's the first time they put it in, as now. They never had it before.
So,
Okay,
so Wilma, you're saying that yes, there is money in the budget? In the
I don't see. I know that. I went to a meeting at the mansion, and I remember the mayor making an announcement that the senior services finally got money in the budget, and they never had it before in the government budget, in the mayor's budget for seniors. So that's why I know it's very new, and not very many people know about it, because it's probably not even there anymore. Used up because nobody knows about it and how it can be spent or used, because it never happened before.
I think in the de Blasio administration.
Yeah, that's what you said, the
right,
previous one.
He's the first one that
Right.
that put it in at the end of his stage of and then came this mayor
Adams.
Adams now. But that was the very first time they ever put money in the budget.
Yeah, I'm not 100% sure. That's before I started with Department for the Aging, so I really can't answer that.
Okay, can we get back? Can I get back to you when you do find the answer? Because I'm really curious about that. It would be nice if we could get back some of these questions answered in another way.
Okay.
Would you be able to send it to John, send the information to John, and then John will send it to us? And we'll make sure we put it in our minutes about that.
Okay, I'm gonna drop my information in the chat so that all the questions.
John knows your
Thank you.
information, right,
Yes,
John?
great.
Yeah, John knows your information.
Okay.
You can do it.
Okay,
Okay.
sounds good.
Ellen, do you have more questions? Is there
No, it's just, this is all
very
very
frustrating, isn't it?
so frustrating.
It goes on from there, I'm sure. Are there other questions?
I don't see any hands raised up
Okay.
right now.
I'm going to bring up first. First, I got permission. I'm going to talk about a member of our community board, and she said, please. I spoke to her. It's a religious holiday. She couldn't come to this meeting. Lori Boris has MS. And she's doing great. She looks beautiful. She's doing great, but she does plan for the future. She cannot get long-term care. Even if she could afford it, there is no long-term care company that would do for her. So she is planning by putting money in a trust so that if she does, and hopefully she won't, but if she does need long-term care, that she would be able to go on Medicaid. What's the likelihood that, and this is something that you hear over and over again, and I know Ellen is an expert on this. Does she have fear? You can imagine, we don't have to indicate, discuss how nervous making this is for her. She did ask, is the city and state doing anything to put aside to help to in the case that Medicaid will be disrupted in one way or another?
So right now, the New York State budget process is moving forward. I think it wise actually that New York State is doing the best that they can to set their budget based on what we currently know. And the state does have a rainy day fund also. So I'll say that.
That's the second thing I was going to ask about.
They
Right.
do have a rainy day fund. It will be interesting to see whether or not the governor deems it necessary to use that rainy day fund at all, depending on what happens at the federal level. I think it wise that we try to set the state budget based on what we know now. And then I do believe if they're able to come to an agreement this month, we'll see what happens federally in May, June, July, whenever they do make their final decisions at the federal level, then probably New York State may need to return to Albany. New York State legislators may need to return to Albany to figure out how to make up for any holes that are created. So that's my answer, but I also want to echo what Ellen was saying earlier in that Leading Age New York has also been ringing this bell for a very long time that we have a growing aging population and a shrinking working population. And with that demographic shift, how do we attract people to this field and make sure we have the services that our older adults deserve and people with changing needs deserve? So we are frustrated too, because unfortunately, from the planning perspective, I would say there's been some failure to plan for what we're currently seeing. Again, I point to the nursing home Medicaid rates just as an example of what happens in a lot of the other sectors as well. Thankfully, lately, the legislature and the governor have been trying to do better. I think the governor has a master plan on aging that she pursued. And there's a lot of recommendations that the state has gotten from stakeholders. So there hopefully will be opportunity to implement some of those strategies as well. But yeah, I mean, I guess that a lot of it is wait and see.
I'm going to ask about the rainy day fund. I heard her interviewed by, I think it was Errol Lewis on New York One, and the rainy day, and are you preparing? What will happen? And she said, well, we do have a rainy day fund, But she said something that I didn't understand. I think she said the rainy day fund can only be used for a one-time event. Can you use it? And maybe she does, maybe it's up in the air. Can she use it to say, we'll cover the gap of Medicare, Medicaid services for our caretakers and so on? Do you know?
I don't know. I don't know. I think the other alarming
She
thing
knows
is
either, I got the
she might
feeling.
not know either. Yeah, I think so much will be dependent on what policy changes are pursued, like which strategies are pursued by Congress and the federal government. And I also think the alarming thing, depending on the dollars that we end up seeing, if it's a cut in the billions, even a rainy day fund may run out
Was
quickly.
going to say, like how much. And on the city, I don't know if Madison knows or do we have a rainy day fund also? I believe we do have some. I don't know how much money. I don't know whether it would cover something as huge as this. And we've had millions or billions taken away from the city government from the Trump era. Didn't he take 800 million, was it? What did he take away from us? I don't know.
From the city, I'm not sure. I know right now it's all proposals right now. Nothing set in stone. Yeah. But I don't know what happened last administration. I'm not sure.
And you know what worries me about the city? I understand that when Madison, when you say um, that we are covered by our taxes, but we have just so much money. So if money is taken away from schools, for instance, will the budget have to shift away from something else to cover some gap in schools? I mean, there's just so much money we have, and there's so many areas of our government that are being threatened at this point. Is that a worry? Yes.
I don't know. I mean, I agree. I feel like everything is under threat. I just got uh from a colleague, got some information to the I mean just yeah, the agencies that are being reduced as well. Potential cuts at HHS and um HUD as well. I mean, we haven't talked a lot about housing here, but affordable senior
No,
housing is a
that
huge
is part of
part,
it. And
a
the
huge
homeless,
part of healthy aging. Yeah.
that's right. Absolutely.
So everything's under threat right now, unfortunately. Here's some good news though.
Okay, good.
And I know Ellen has a
Promise me I
question.
wouldn't lose sleep tonight when I
I
saw
know. So I'm a believer in advocacy. And I'm sure that's what Madison does as well, being government affairs professionals, right? I do believe in advocacy and having a unified voice to advocate for the things that are important to us. So I will share some resources about Medicaid advocacy that you can take part in. The other positive is that I think the most people care about older adults. Our issues are bipartisan, and there are people. While the sector is under threat for sure, the healthcare sector is under threat with the numbers that are being floated. People do care about the well-being and the health of older adults, and that's been one of the messages that's resonated the most with the congressional majorities is that we do not want to. They say they do not want to cut funding to older adults and our most vulnerable, medically fragile children, people living in pediatric homes. They don't want to see cuts there. And I think we just need to make sure that they understand that any cuts to the system itself will probably translate to reduction in availability of these services. So we just have to make sure we connect those dots because they don't want to see lack of access to care. And I think they just need to be reminded there's already a lack in access to care. I mean, Barbara, you shared the story of your friend and this community member that is already having challenges accessing the care that she needs, or she's already seeing that
she's
that's going to
fine
be a
now.
problem.
She's doing in the
Yeah.
future. So I want everybody to know, everybody
Yeah.
last night, she's doing great and she's
That's
fine.
great.
In fact, she's off from it. But the other thing she said that she just found out is there was money put in the Defense Department for study of MS. And the reason defense is there seems to be some relationship with people that come out of the wars and so on and getting MS. And that was just defunded. So even research about MS, as she said, if anybody knows that, but that's a little bit off there. Is there anything you think that we as a community board can do? We talked about, is there something that you would want, and Madison, I'm going to ask you too, is there something that we can advocate to our elected officials to say that we're hoping to do? Is one what is it called, PPL?
Yeah, so.
Is something with the PPL, for instance, is something that
I don't have quickly at my hands any PPL advocacy resources, though, CDPAP advocacy resources, though I could probably do a quick search and try to direct you somewhere for that. I dropped in the link in the chat is Leading Age Nationals Advocacy Action Center has a few different digital letters that if you input your information automatically get sent to your members of Congress. So that's an option. Of course, being in more democratic leaning areas right now at the federal level will be less influential, but I welcome this group to share those letters with any of your friends or colleagues throughout the nation, really, particularly if they're in Republican leaning areas. And then on the state side, I have advocacy resources too, though I know a lot of the attention is on the federal, but we definitely have Leading Age New York has resources in terms of state advocacy too, to enhance access to services. So happy to share those, but for now, just sharing the Leading Age national ones.
I possibly put it on, if I can get it, I will maybe you would send it to John and I would get it and make sure I put it in the minutes and talk about it. Wilma, do you want a resolution about something with the PPL? That's something the state should do?
Well, I just think that the sooner the state, if they can find a way to do what they have to do to rush the budget to pay these superintendents, it would be greatly appreciated by the people that are the client and also people that are the home attendants, because both are suffering.
Yeah, I mean, the whereas is that the system was changed and it was changed to streamline, but in the meanwhile, those that are being underpaid now and working very hard now are not getting paid at all. That's affecting the care of those that they're supposed to care for. Does anybody agree with that? Would anybody want to second that?
Meryl.
Meryl?
Who's it up there?
I'm sorry. Can you repeat that, Barbara? I was just reading this thing that was sent to me earlier today. Can you hear me?
Yes.
Yeah, which is astounding. Another astounding thing that the administration is trying to dismantle the agency that deals with seniors, disabled,
on a federal level.
The AC, yes. So even before, I don't want to read this entire article, but I can read part of it if you want. This comes from Stat News. Even before the Department of Health and Human Services announced its recent major reorganization, there was the very last bullet on the HHS fact sheet was a complete surprise to most people. The elimination of the administration community living ACL. Furthering this goal, the HHS fired nearly half of the ACL staff as part of an
ATL. Do you know what ATL is?
It is Here it is. ACL was created in 2012 to focus on the needs of both older and disabled Americans, as well as their families and caregivers. With over 11,000 people turning 65 each day, more than 1 in every 4 adults experiencing disability, including most adults over age 75, and the number of older adults predicted to outnumber children by 2034. Now's not the time to dismantle ACL. If you're an older adult or person with disability or family caregiver, you've likely participated in one of ACL's critical programs. Annually, here it is, ACL's nutrition programs provide more than 261 million meals through programs like Meals on Wheels. ACL's family caregiver support helps over 1.5 million families each year, allowing their loved ones to remain at home. Nationwide, millions of Americans participate in programs at over 11,000 senior centers funded by ACL. Independent living services assist 250,000 disabled people of all ages, from helping people transition home after hospitalization or nursing home stay to getting a job. ACL's state health insurance program provides counseling to 1.8 million low-income Medicare and Medicaid beneficiaries to help them understand their options. ACL programs also include home supports, legal assistance, research initiatives, and support for families of children with disabilities, among many others.
I think that's the Administration of Community Living, right? Is that the acronym?
That's it. And then it goes on. So I think we need to look at this in any kind of a.
And how does that effect go down in terms of the state and the city?
Right.
Do they don't do it, they must give.
That would affect the city and state?
Do you know, Sarah, Madison?
Madison, I'll let you attempt first, and then I could either way.
Okay.
Are you familiar with ACL? I'm becoming familiar through these changes, but at the city level, are you?
No.
Yeah, I guess again, to use more of an analogy, because I'm not as familiar with ACL, but I just know from an operational standpoint what happens when there are fewer staff, right? We deal with this at the state level regarding like Medicaid increases. If our advocacy is successful at the state level and we secure additional Medicaid funding, that's enacted via state policy, it often takes a long time to get those dollars dispersed and get programs implemented. And the fewer staff you have in an agency, the slower those things tend to go. But in terms of programs related to ACL, I can't speak exactly to, but I do think it might be a concern related to how many programs are even just operationally able to get off the ground, things like that. Certainly a signal of where dollars are expected to flow, potentially.
So what I'm concerned about is that Congress is going to enact a block grant and give New York State a block grant. And now if ACL doesn't have their money, if we don't have the ACL money on this side to provide services, then we have to use Medicaid money to provide those services, possibly.
Or not provide the services.
Where does all this money come from to take over where that money got taken away?
I can't believe it wouldn't filter down to the city level also. Do you agree?
I would agree.
Well,
so Barbara, what was your resolution?
Well, Wilma left at this point. She would like something that on the state level, this PPL, that is a snag. They keep promising that the aides will in fact get paid. You know, she needs a full-time 24/7 aide, and they haven't gotten paid. They've been working for her. And I don't know how long, but I've been hearing about this for a while. What? 3 weeks? And so she wanted something to say that the state needs to facilitate, to speed up the process. That and the whereas clauses are obvious and it could speed up the process so that, um, they would be able to function and get paid.
The client cannot keep feeding
I
them.
can't hear you.
I, as a client, cannot keep feeding them, but they have to eat when they come.
Yeah,
They eat 24 hours.
right. I mean, they don't have food. They don't. Any questions? Anybody's hand up or?
Yeah, Marley. It's
Okay. Who is it whose hand is up? Meryl?
Merrily, yeah. Merrily, I'm unmuted.
You unmuted Meryl? Okay.
Uh,
Meryl?
Looks like she's trying to unmute.
yeah.
I was trying
There we go.
Hi. Okay, was somebody else trying to ask something before me? Because I spoke. I do want to say, though, that in the event that what Ellen Pallavi said was correct, if we are not going to get Meals on Wheels from the federal government, the city's ability to provide such meals and healthy meals is limited to how many people it can do. 1.7 million seniors is increasing, not declining, and a lot of them will go hungry. Even if they have money, they don't have mobility. All right, back to Wilma's problem. That's a huge problem. Even were they to increase a program, say the ability of relatives to help senior citizens and to reimburse that, there would still be a dearth of people for those in, for example, Section 8 housing who do need 24/7 care under Medicaid, and wouldn't that be the first thing to cut? Now, the city's going to be able to do something about it because it does have homeless services. It does provide certain other benefits, not enough. Do you want to resolve specifically to that issue, or do you want to resolve in general that we want somebody to explore how the agencies, how Sarah's agency, how the city agency is going to be affected by the cuts and what we can do in terms of
It's a second
arguing.
issue. This is a very specific issue. I was hearing advertisements nonstop on television, those pro and con about the PPO, where people said this is terrible, they're taking away our health care, they're changing it, and so on. And the governor swore that it's streamlining, that you'll get better care, and so on. And maybe will eventually. I don't know if either one, Sarah, if you know
Wait a
that.
minute, is it a state cut or a federal cut?
State.
It's a state. It's not a cut,
Okay.
it's a change.
It's a change.
Okay.
Yeah. And they've tried to streamline the way that these individuals, these hardworking people are paid, and it's through one fiscal intermediary now. And I have colleagues that can speak more eloquently to it.
That could live on their extra $1 million while they're not getting paid. You're talking about affording food, affording rent.
And these people pay low wages.
Yeah, they paid low wages to begin with.
And they use the check to check. They need the money to pay their bills and to feed the families.
So Wilma proposed a resolution. Does anybody want to second it? Does anybody feel?
I'll second it, sure, but it's a very specific resolution.
That's a very specific one. There could be a second one also if you want it.
Well, we could ask the wonderful guest to come back and in the meantime, develop a resolution as the theme of another meeting.
Well,
up to Barbara.
But does that
all the questions?
Who is still on from the community board, John? I lost the
that would be apologies.
Bill.
Bill's here still. Judy, I'm not sure if she's still here. Like she's not like.
And there's Meryl and Ellen and Need. So can we take a vote? Is it Bill?
Okay, we call the question. I move to call the question. Is the question called? Anybody all in favor?
Well, let John do that. Okay, Meryl.
Okay.
What we say is anybody not for it. Those that are on the community board, is anybody not for that? Okay. And I think that's something that can go to our assembly and state senators, even if they're Democrats, that to say something has to be done. Ellen, do you want to propose, or is it Merrill want to propose something else?
I think Ellen had some good points on the community living, Association of Community Living. Unless she wants to do it now, fine, I'd be, go for it.
I think we need to say something like, I mean, this all
Is brand new.
all determine this, what they're recommending, what ACL is recommending is that people get lobby HHS Secretary Robert Kennedy to change his mind about taking this out of the
He's
budget.
not Kennedy, he's the health.
No, he's
Oh, he's
HSS.
self-insured. He is.
jurisdiction,
Yes,
yes.
HSS.
What is he
Yeah,
going to change his mind?
to rethink his plans to remove this agency because it provides such streamlined services. But
Well,
I would suggest that we have a very simple resolution that that the state prioritize the vulnerable population of seniors and disabled in their budgets, you know, in their
state and city.
contribution, right? The state and city just prioritize vulnerable
I think that's a fine resolution that we move to make more local services. By local, we mean state and city expenditures for senior citizens. Vulnerable groups in and around 75 plus who have been currently the most victimized in terms of budget cuts.
Yeah, I have a question. Who does pay the aides? The aides that we're talking about, is it state, city?
I think it's state Medicaid.
It's state dollars. And yeah, actually, I mean, this, unfortunately, this program, consumer directed care, and this is very speculative because we do not know what kind of, again, difficult decisions New York State would have to make if the Medicaid funding that comes to New York State gets cut. So I'll just leave it there. But the Medicaid funding that could be reduced to New York State, the state dollars that we receive, there may be other changes coming down the line to consumer directed care.
So it's too early to have a resolution like that, would you say?
No, I think that to the issue that Wilma is asking about, I think you should
no, the
if
PPL,
the board
I think,
approves,
is a different thing.
that's different.
current.
Yeah.
But I think I think where Ellen was, you know, Ellen and Meryl were starting to speak to is just maybe more broadly speaking against potential cuts to Medicaid that would impact older adults and vulnerable individuals.
Yeah.
I think is a general message is the most powerful one right now.
Okay, without saying that there will be cuts or anything else like that.
Well, there will be cuts, but at least that suggestion would give some thinking or some work on what the cuts are going to be and how to stop the cuts. Not stop them, but you can work on advocating for more money this place or that place.
As a New Yorker, if you don't want to see Medicaid dollars that New York State receives reduced, you
Sarah,
can make that
I might be
known.
calling you for wording. Get exact
I'm happy to provide resources, and I know that any resolution needs to be of the boards and completely approved by the board, but I'm happy to assist. I think, but yeah, to me, the message is any dollars that New York State loses to then disperse for these programs, such as consumer directed care, which is a state-run program. We don't know what the impacts are going to be. And there's other community-based services. There's so many community-based services that are state, you know, New York State Office of the Aging that they run.
Right. Anybody, is Bill still on? I see Judy
Yes,
still on.
I mean,
Do you have any? Yeah.
one of the proposal I would suggest a resolution to oppose any federal effort to reduce funding for Medicaid and Medicare, and to advocate with any New York congressional delegation for full and sustained funding of these programs.
I love the wording of that.
wording on that, yes.
Good, I'm a second, third that one.
I'm going to second that. I think that's basically the same thing as what you said, Ellen, and elegant.
And if I may, I'd like to add
Well,
one
he
more.
threw in the congressional delegation, which I think is more specific, and I think we can, to whom would we send that resolution?
Well,
Chuck
the
Schumer?
office
Send out
knows
to
how to
this-
send it. Yeah,
That's
We send
right.
to the
Okay,
senators,
there
to
is a way of
congressmen.
going with it. Mhm.
yeah.
The Secretary of the Congress or something.
Well, yeah,
If I may, I'd like to add another resolution
sure.
for
So
the,
first, should we vote on this one first? Is anybody against Bill's resolution?
No.
And Bill, you're getting a phone call also. You know that. Okay,
I'll
And-
write that down.
so that's one. So that's a second resolution and a third resolution you have, Bill?
yeah, I'm thinking, hearing the conversation, perhaps the city need to implement any action plan to protect services for older adults in the event of any potential budget reduction.
Isn't that the same as the other one?
Is it?
Is it, what is the difference?
What
The
you said,
previous one that the
Well,
one
the
you,
second one, the first one was PPL, the second one was congressional,
right?
uh,
And
and
what's
the third one is,
the third one, in the
and it's
event,
saying
in the
the
event
city-
there is a reduction, then there's to come up with some action plan to protect
a backup
services
plan.
for older adults.
That's
For
perfect.
example, the city also has a rainy day fund. Are we going to take money out of that when everybody else in the world is going to scream rainy day? So, but I think that his idea, I think it is a third and different resolution, and we should pass it.
That's great. So everybody agrees. Judy, you're still on. I haven't heard from you. And Wilma said yes. She just left the room, but she said yes. And
I sorry, Barbara, I do have to point out, I believe Judy is away actually. I see the coffee symbol, so.
oh, okay. Well, I think we have three resolutions. Madison or Sarah, do you have anything more to say? Any comment about it?
I feel like I have always so much to say on these issues. I appreciate everything that's been said by all of you. I just couldn't agree more in terms of how critical these services are, and that, I feared for what might happen if the New York State has to make up a whole, but I also think that with community participants like yourselves, we have better odds to navigate this unprecedented situation. But I also just implore you all to advocate, obviously these resolutions are extremely powerful, but also calling representatives is really, really important now. I don't think there's any such thing as being obnoxious when it comes to advocacy for things that are critical to your livelihood and your well-being. So just use your voice because it's really important right now.
And you'll
And
say that's
yes.
the way of signing up for it.
I
Yeah.
think
Put it on, I don't know, John, if we'll put it on the website or what we'll do with it, but we'll certainly mention it. Thank you.
Thank you so much.
Is there anything more that
Uh,
anybody wants to say?
John,
Yeah,
No.
this
Yeah,
was, I believe that this resolution should be shared with the officers of the city council, speaker, the
yes.
mayor, the New York City comptroller,
The mayor.
the
the
mayor.
state assembly, state representative, and the federal delegation, like congressmen and senators.
I would also like to
Okay.
send it to every one running for mayor.
Yes.
Well, and also the Department for the Aging, because they're the ones who are.
Yeah, yes.
Yeah, Department of Aging.
So Madison, you'll be getting it too. And maybe on the state level also.
Especially state level, because they're affecting a lot of the people.
Yeah, no, we definitely need it on the state level
They have
and
a lot of
possibly on the
loopholes.
federal level too. John, I think you and Will would know exactly who to send it to.
Can we send a letter to Kennedy? As a community
Well, I
vote?
think this resolution will go to him. Ellen, is he going to listen to you?
No. Will he listen to the, well, you know what? Enough people saying how it's going to affect individuals in the community might help.
Right.
If he gets letters from different communities.
Yeah.
You know, when we were fighting fracking, the Roosevelt Island Residents Association wrote a letter to Pennsylvania about fracking. And do you know it's on their website? It's in the Pennsylvania Water Authority website
They
about
may have a rule that says they must publish whatever flows through their office.
Well, we certainly will go to, this resolution will go to HSS, to
A lot of people.
Mr. Kennedy. And I'm just stuttering because I'm wondering if we could even go beyond our confines. I don't know. I would
Yeah,
love,
but maybe they won't be there long enough to make it any, maybe it'll be postponed and delayed for the longest time due to the congressional impetus that's behind all this. And our resolution, of course, and it just won't happen. It'll just
possibly.
wither away.
I think we
That's
need to
all.
put some statistics in this resolution.
Well, I'll need help with it. We
Right.
will, all three of them.
Barbara, I do want to point out a constituent does have his hand up, Antonio. Just want
Antonio?
to
Oh,
let you know
good, thank you.
I just wanted to. Can you guys see me?
Go ahead.
Yes.
Yes,
I also think one of like for advocacy, I think it would be cool if like maybe if you guys got college students involved with helping seniors. I think they're mature enough to help the programs like the Row or Carter Burden. Um, like having some type of outreach for that, I think can go a long way. And that's kind of like a suggestion that I think comes to mind.
That's good.
I love it.
I don't know if a community board can do that. I understand what you're saying, but Sarah and I mean, you could probably use something like that. Am I right?
It's a good idea for me in terms of expanding. I'm always looking for ways to expand advocacy reach, so it's something for me to mull over and can take conversations offline. Antonio, if you ever have, John has my contact information. I can drop my email as well. But always welcome opportunities to educate more folks about these important issues. So.
There, can you'll put your email in? Because I have a webinar for send you defending basic needs programs, important new poll to guide effective messages. I don't know what poll
There's
means.
certainly going to be a lot of forums. Liz Kruger's having one, our Congressman Jerry Nadler's having one, different town halls discussing what to do. So I think we could bring this resolution if it was passed. I'm not sure. I don't think it's been passed. It has to be passed by the full board, and I don't think there'll be time for that. Anything else? Any other comments? Thank you for Antonio for coming. I hope you come to more of our meetings.
And thank you everybody for the information and
Right.
all of the
And the support that we're,
Yeah.
thank you for bringing that up, Wilma. That was good to do that. Anything more? Can we let our speakers?
If I may, just to echo Antonio mentioned, you want to include that in the resolution to encourage public participation by providing educational outreach and public comment opportunities for older adults to amplify their voices.
Yes.
Good.
Bill, you'll have to help me which one of those resolutions and how, or both, or the PPL is a very, very specific one.
Yeah. How many we have 3 resolutions now.
We have 3. One is the PPL, and the other 2 is basically saying, in case there is, well, one is right now there's not enough, and the other in case there is a cut
Yes.
that we have to prioritize.
But I think in the third resolution, it kind of fits because we're talking Duro, which is an extremely popular agency for senior citizens. And we can, outreach includes private eleemosynary and public organizations on the local level and on the state level, and somehow include that in the gamut of saying that these basic services to vulnerable groups should not be cut. These organizations should be informed and well, allowed to help out. Not that they're not allowed to help
Very
out.
good. But so Dorot is a private organization. It's not part of the city. Am I
They
right?
probably get some sort of subsidy, but I'm not sure from whom.
Madison, do you know? Is Madison still on?
She's giving the thumbs up, it
Yes,
looks like.
you,
Okay.
yes, you're right. Sorry, I can't unmute without yeah.
So
So yeah,
Dorot is part of the city,
no.
but do you give them money? Are you a source of money for them?
We they could be one of our providers. I'm almost I could confirm, but I'm not 100%
Okay.
sure.
Thank you.
Mhm.
Okay, that's good. We will figure out where to put that in. Any other comments? Well, this was an interesting, Sarah, you
Oh
didn't tell
yeah.
the truth
I
that
guess
you
it,
will lose sleep tonight.
no.
It is a very, very scary time, and particularly for those of us that are getting older and need the help.
Absolutely. I think the last thing I just want to note for the record is that, again, I am also a constituent of the Upper East Side. I live on East 83rd Street, and so I just really do appreciate the work of this
Oh.
community board.
And what have
Um,
you? Where?
I don't want to give my full cross streets
Okay.
just because I know this is recorded, but I do live in, Nadler and Kruger and Sea Rights District. I'm also a New York City
Oh, good.
taxpayer.
My
So
neighbor.
this is my work. I'm obviously here in my work capacity with Leading Age New York, but it's also these issues are things that I really care about too, as someone with aging loved ones. And again, we are all going to be there someday. So it's just really important that we have the systems that we need in place.
I'm worried about young people like you because we're using up the resources.
Well, we'll figure it out. It's not, you guys didn't create these problems that we're facing, right? So
Right, we're gonna solve all of them, but okay.
No, the thing is, there will be resources when younger people get older, because it's like, I know that I know that Elon Musk said it calls it a Ponzi scheme, but it basically everybody takes care of each other. I mean, that's what we do as a society and a government. That's how government works. And the people coming up work and pay into the system, and we pay into the system, and we reap the benefit from everybody else. And eventually the big baby boomer bump will die off, and then we won't have to be taken care of anymore. But right now we need to be taken care of, because you can't just have people dying in their homes because you don't get enough food or you don't get enough, services. And you can't schlep somebody off to a nursing home because they don't have enough money either. So then what do you do with people? It's far cheaper to keep somebody at home.
That's what said, yes.
That's right.
And
I have a quick question.
and give them a little bit of help and provide services from communities. So it's
The
very
VA
frustrating. We need to get this out there, let people know that, we're not the mooches that,
Well, we're doing it with the 3 resolutions.
yes, and I think that has to go to the federal government.
Okay.
Thank you, Barbara, for having this.
Well, thank you, everybody. Thank you, John, and thank you, Madison and Sarah, for so much. I will help you in 1 second. Can we call it a night? Does everybody agree?
Okay, anybody, I move to adjourn. It was a great meeting.
Thank you so much. Great.
Second?
Thank you.
Second, take care.
Thank you.
Thank
so
you
much.
all.
We'll be in touch. Thank you
Our
to
pleasure.
both of you. Okay, great. Bye-bye.
Bye.